So we were looking for people to tell us what they were experiencing through the COVID outbreak, the early part of it, and then to really try and learn from that what we could do better in the future. So people said that they felt very strange as unpaid carers. So they were not getting the support they had. They had worries about doing it properly. Particularly financial stress was a big factor as the stock market went down, interest rates went down, and people could not get rent from their rent properties, a range of things that all came together. And then panic buying, not being able to get your basic supplies, going in on the special days when older people could, but there was nothing there to get, and a list of other concerns really about, being connected and being able to talk to people.
Certainly a lot of concerns, and also in the survey there was a third of the respondents who were older Australians providing care for a loved one. What were their main needs?
Well, I think the greatest concern is for that group because we've got about 60 billion Australian dollars that's provided in unpaid care through any year in caring for older people. So what they didn't have was very clear guidance. It was quite confusing. It was changing all the time, sometimes too much. And then some people don't have access to it because they don't have internet connection or they don't use it very well, they can't do it. I think help with care planning. So when things came up, particularly when some crisis came up, they couldn't get the support they needed. And then they had higher costs as well because they were shut down and possibly couldn't do the things normally they could do at very low cost. I think also that they need to be recognised for what they are. They're part of the unpaid, but they're the care workforce. And this was not recognised as an important thing. They weren't registered with GPs and found it difficult. They could not access family members, partners or parents in nursing home and aged care because they were shut out. So a range of things are very difficult for them in their hard job of being carers.
Older Australians, especially those relying on investment returns as retirement income, said that they felt financially forgotten by the government.
Yeah. So I think this is something like what happened to people through the bushfires, that they went through very difficult times and then people felt there was no support given. Now, what happened here was much more immediate, that the whole investment market and interest rates and rent and properties all went down at once. And then you're an older person struggling to maintain your status as self-funding, or you're just struggling to maintain paying your rent if you're in a residential aged care or those sort of things. You're struggling with that, and then you find other people getting support and you're not. So I think they felt very left out and very, very lonely, if you like, in terms of the interest that was in their needs as well as others.
And I did read that you had a quote saying that retirees do take pride in not relying on the government for support, and then suddenly they lose their income and feel they're not even acknowledged by the government.
Absolutely. So I think there's a great pride of being self-supporting in old age. It goes back in time to when it was a very privileged status, and now it's more general with superannuation coming in. So people take a great pride in that. And when they can't do it and it suddenly hits them all at once, I think they felt very disappointed and really wanted to get back to that status of being independent and supporting themselves, but there was no way of doing it. So I think that struggle is very important, and that will continue for a while, I'm afraid.
Yes, it certainly looks that way. Carers also had trouble adhering to social distancing rules. Is there anything at all that we can improve on as we move into this next phase?
So certainly I think we have to learn from this, and that's, getting the information out in simple terms and keeping it as consistent as possible. And I think then we really need to recognise that carers are part of the workforce, and they're a very significant part of it. If we don't maintain that, then we've got a lot of economic cost coming. So in that sense, we need to give them access to training. There was training available, but it wasn't promoted with them, and they had to register because that was what the website was doing, so the government would know how many people were doing it and who they were. But people have a barrier to that. If you're working at home, it's not the same as if you're a paid worker. So getting that training out and then being recognised and supported by health professionals so that they can actually do their work as well. And again, being recognised for what they are as workers. I suppose the other thing is we really need to be conscious of the combination of issues that were going on for carers. They were getting greater costs as well. So maybe some more practical help they need and getting that to them, as well as economic support. just to cover some of the little things that became costs for them and a particularly difficult issue.
Some experts would say, Professor, that we haven't even entered our first wave of this pandemic. As we head into the next stage, I guess, what else can we learn? What could we do differently? What do we need to do? And also perhaps document historically?
So I think what's happening now is we've got now our community transmission for the first time. So I think we have to deal with that. That looks more, happening in spots or in states in one case, rather than going national with some of these things. So we've got a lot more variety here. So people have to be bought into that. The decisions have to be made very quickly. You have to act with great leadership, and you have to be doing the right thing. So learning from these very simple things, supporting people, keeping them active, keeping them going, keeping them supported financially as well if that's really needed, and using the community as much as you can to do that, I think, is really the important way forward. We're totally overwhelmed by the residential aged care cases, and that's justifiable, but we've got to keep the community going as well.
Yeah, absolutely. Well said. Professor John McCallum, you stay well, and thank you so much for your time.
Thank you very much.